Hello, everyone. My name is Wendy Myers. Thank you so much for joining me for today's Facebook Live. Today, we're going to be talking about lead toxicity and the signs and symptoms you have lead toxicity, how you're exposed to lead, and how to detox it. I'll go over some of the top supplements to detox lead. And I'm also going to answer any questions that you have if you're on my Myers Detox protocol. If you have any questions whatsoever about binders or detoxification or my new Mitochondria Detox supplement kit, I'm going to definitely talk a little bit about that as well. Misty, thank you so much for joining me. You're here every week. I love it. And Stephanie, thanks so much for joining me as well. And so let's talk a little bit about lead. Let's delve into it. You guys have probably heard a lot about it on the news in the last year, the crisis in Flint, Michigan, where there's a lot of children that have been impacted and become very, very lead toxic as a result of the city adding chloramine to the water and the lead pipes etching a lot of lead into the water. And it's a really big problem. There's a lot of lead pipes still out there in our water system, and it's really, really important to have a whole house water filter to remove any lead that can be in your water. It's also really important to do water testing. I have a water test kit on store.myersdetox.com, so you can find out what metals you have in your water and get the appropriate filter to remove that from your water. Because when you're taking a shower, you absorb a gallon of water in a 10-minute shower. So if you've got lead or uranium or arsenic or other common water contaminants, including lead, you can be absorbing that through your skin every single time you take a shower, even if you're drinking properly filtered water. So I did a test on my water here in California in Los Angeles, and I have uranium in my water. And all of my clients that I've tested, I've done a hair mineral analysis for in the California area and many people in the Southwestern United States, we have uranium contaminating the water. So just an interesting side note, just wanted to speak to the importance of testing your water. And so like I said, if any of you guys have any questions whatsoever, anything comes to mind throughout the course of my lecture about lead toxicity, don't hesitate to leave a comment. So let's get into lead. So today, everyone is lead toxic because of many different exposures that we have. So lead gets stored in our bones. It's not something that's going to be readily shown on tests. Many people do a hair mineral analysis, and I don't see any lead on their tests at all. There's a handful of people that have come back with lead, but the majority of people do not, yet they still have lead in their bodies, and the body just stores it away in the bones. That's the most popular place the body likes to store the lead, away from the vital organs. And the reason we all have lead is because of leaded gasoline. So for decades, lead was added to the gasoline. This is still a common practice in third world countries. And it just leached into the environment from auto exhaust, and then it's settled into our soils. And it's still present today in the soil. So it's getting to the vegetables, it's getting into food-based supplements. It leaches into the water supply when there's irrigation of the crops, and then it gets into our water system and into our drinking and showering water. And lead is a big cause of fatigue. If you look at lead and a mitochondria under a mass spectrometer, you can see that lead completely surrounds the cell, and it pretty much chokes it off. It completely surrounds the mitochondria and chokes off its ability to make energy. And that's why people that are really, really lead toxic, I call them lead heads. They're extremely tired. They'll sleep for 12 hours a day. They just have chronic fatigue. And lead also damages the nervous system. It damages the reproductive organs and the kidney system. So it's really, really important to have some awareness around lead and perhaps do some testing. You typically will see lead on a urine metals analysis, doing a DMSA challenge test. That's the best way to see lead, and then work on detoxing it from your body. It can take quite some time because we are very, very lead toxic. And so lead primarily accumulates in our bones, and it's really done to protect the body's vital organs. And it's really interesting that once women reach menopause or men reach andropause, bone cells have a faster turnover rate, and it's due to lowered estrogen levels. Estrogen has a protective effect with your bones But when you reach menopause, you have lowered estrogen levels, and then lead starts coming out of your bones at a faster rate. And lead can then lead to cataracts. It causes fatigue and brain fog. And a lot of people think they're just getting older, but they're in fact just suffering from the symptoms of lead toxicity that's now leaching from their bones. And so let's talk a little bit about where you get lead. So you can identify lead from ammunition. So in war-torn countries where there's a lot of ammunition in the soils, lead can be leaching from those into the soils and then get into the water. Auto exhaust, batteries and battery manufacturing can be in cigarette smoke is a big contributing factor when, people that smoke cigarettes get cancers. Lead can be a factor in that. Coal combustion, colored inks, like some cosmetics, like a lot of lipsticks have lead in them. So you want to make sure you purchase lead-free natural lipsticks. Root canals, sometimes the root canals are packed with lead. They can also be packed with mercury. Some eating utensils, there's some lead-based ceramics. You have to be very careful if you're traveling abroad and buying ceramics. There are going to be lead glazes that are covering the pottery or the ceramics that can contain lead, and people will be eating off them and getting really, really sick and not realize it's the utensils that they're using. You can also get lead from farm equipment, from gasoline, again, petroleum deposits, from hair dyes, especially black hair dyes. I know that Grecian formula for men definitely has lead in it. Herbs, especially from China and India. You have to be really, really careful when you're choosing supplements because herbs that are grown in soils in India and China can have very high contamination levels. So you have to be a discerning consumer when you're buying Ayurvedic herbs or going to a traditional Chinese medical practitioner, because they're going to give you herbs that are grown in China or India after a consult. And we know in China, there's so much industry, there's very little regulation in industry there. And you see these smokestacks, you see lots of pictures in China, all these smokestacks, all these, companies doing dumping in the waterways in China. And, the crops are then irrigated with these very, very toxic water. And the metal levels in the soil in China are alarming. There's definitely nickel, there's lead, there's mercury, there's arsenic, there's cadmium in the soils. You don't want to be consuming supplements, namely Ayurvedic or traditional Chinese medical herbs that are grown in these regions. So you need to know your source, call the manufacturer, make sure that any herbs that you're taking are grown in the United States or grown in other countries where we know we don't have that contamination. So lead can also obviously be in lead pipes, lead glazed earthenware pottery. It can be in mascara. Lead's very dark in color, so a lot of different mascaras can have lead in them. You want to make sure you're using a natural mascara. And metal polishes, newsprint. So if you're holding a newspaper, the inks that get on your hands can have lead on them. And then you can soak that lead into your skin. That's why I don't ever touch newspapers, because I don't want that ink soaking into my skin. You can get occupational exposure. You can get exposed to lead that way in manufacturing. Some paints can have lead in them, especially the dark colored paints. Pencils, pesticide residues, of course, different soils can have lead in them, and some toothpaste, and then water. Oh, we've already mentioned that. And so I want to answer some of your questions here. So Leslie is picking up lead tire weights, somewhere one could get lead toxicity. So yeah, anything that contains lead and you pick it up with exposed skin, your skin is very, very porous. That's why one of the fastest growing types of class of drugs is transdermal medications, because your skin is very, very adept at absorbing things through your skin. And so anything that you touch that is made of lead, the lead tire weights, you can get an exposure that way. So just use some gloves if you're doing that. Genevieve, hello, I'm diabetic, so I'm wondering if I can use your detox. So yeah, people that are diabetic typically will have arsenic toxicity. They can have other types of metal toxicities that interfere in blood sugar regulation. So detoxification is really, really important for really any type of health condition that one may have. And Vicky, so I'm currently on DMSA, been chelating off and on for 3 years, and I'm postmenopausal. So I'm assuming that you're doing the DMSA for lead toxicity. DMSA is a very, very effective amino acid at removing lead, and it's one of the top ways to remove lead. The only problem with it is that it takes a really long time to remove lead from the body because we have so much stored in our bones. And DMSA isn't something you want to take on a long-term basis. But it's definitely a start. It's definitely a great way to bring down lead levels quickly if you have very high lead levels. And if you're postmenopausal, a lot of postmenopausal women do test really high in lead. So I understand why you're taking the DMSA. But there's some other things I want to talk about at the end of the lecture that are very, very effective and aren't nearly as toxic on your kidneys as DMSA. So Raymond, does anyone know how to smartly use EDTA to help safely chelate? So yeah, so EDTA suppositories are a great way to detox lead as well. And that's typically what I'll start clients on with is EDTA suppositories. You can do EDTA chelation as well, but it can be hard on the kidneys. And the clinical research shows that 3 suppositories a week has the same exact effect as one session of EDTA IV chelation. And it's a lot cheaper, it's more convenient, you can do it at home, and it's also much safer. It's better for your kidneys as well. So EDTA suppositories are fantastic. I really like Chelatox suppositories. They're extra strength, they're 1,200 milligrams. There's some cheaper products on the market, but they're much less strength, they're not as strong, so you get what you paid for. And so you want to be making sure if you're buying EDTA suppositories to compare the milligrams on the boxes, as you really need the 1,200 milligrams per suppository for it to be, maximally effective. So Nick, thank you so much for joining us. So I've been detoxing lead for a few years, but still have high levels. Seems my body won't let it go. Why would that be? So it's not that your body isn't letting it go. It's just that we are very, very lead toxic. All of us are in the same boat. We all have very high lead levels. It's just typically not detectable on tests. And what I found working with clients is we'll start, identify some metals on their hair mineral analysis, on their urine test or what have you, and then start working on detoxification. We'll start getting people taking minerals and vitamin C and, other types of supplements that start getting the body detoxing, and then do detox protocols like infrared saunas and coffee enemas and whatnot. And then slowly the body starts detoxing, and after a couple years, lead will begin to come out. Many times we don't see lead for a while because the body has other things that needs to detox. It has other things that it needs to do. And so we don't typically see lead for a little while until the client's ready, their body's ready to let it go. So it's not that your body won't let it go. It's just that, it can take quite some time. I had Dr. Gary Gordon, who's kind of like the god of chelation, on the show. He's in his late 80s and still working. He's amazing. And he said that it can take 7 to 10 years to remove all the lead that we have in our body. And so that's why I can't stress enough that detoxification is a lifestyle. It's something that takes quite some time to remove the majority of metals in your body, and lead is no exception to that. So just keep trying, add detoxification strategies to your already healthy lifestyle, and you'll eventually get where you need to go. So Raymond, so Nick, other than, I guess, tests show your body is holding onto lead, how do you feel? Judy, so I have lead toxicity possibly from working with stained glass. Yeah, stained glass can have a lot of different metals in it depending on the color. And I was on DMSA for 4 years without much improvement. So I don't know if you were, can you tell me what type of DMSA? Was it was it oral DMSA? Was it IV chelation? Sometimes if you're taking oral DMSA, you don't really have much of an effect. We don't really absorb DMSA very well orally. So that may have been the problem if you weren't taking DMSA correctly. A lot of the DMSA available on the internet it's not very, very strong, or it's mislabeled. It'll say it has 120 milligrams, but it may only have 20 milligrams. A lot of it's garbage from China. So you really have to get a prescription from a medical doctor, from a naturopath for DMSA if you're taking it orally. And I doubt you've been doing IV DMSA for 4 years, so I'm assuming you've been taking it orally, and that's why you really haven't had much improvement. But it could also be that you have other things going on in your body other than just lead toxicity that need to be addressed as well. So Vicky, never detox with DMSA or prescribed drugs unless under a doctor's care. Absolutely. And I take DMSA 3 days on and then 11 days off while replacing minerals. I work in the printing industry directly around lead and melting lead in the building. Yeah, unfortunately, like I said, people in manufacturing can get some pretty bad exposures to lead through their skin or through breathing it in. And 2 coworkers passed away from this toxic exposure at too young an age. Yeah, I'm very sorry to hear that. It's, and it's a reality today. A lot of people in manufacturing do get a lot of different exposures to metals, and lead is no exception to that. And so that's great that you're working on detoxing the lead and recovering your health. But yeah, there's definitely many different ways to detox lead, which we'll get into in a few minutes. And taking oral DMSA is, definitely one option, but there's other ways as well. It's more natural ways that you can detox that as well. And let's see, so Lois, do frequent coffee enemas make the gallbladder lazy or dependent? No, I don't believe that they do. Coffee enemas, your body certainly can acclimate to coffee enemas, and you don't want to be doing them every single day. I think 2 to 3 a week is a really nice pace. And so it's not that your gallbladder gets dependent. What the coffee enema does is it actually facilitates the excretion of bile. And you need bile to detox metals. So it's very, very important. One of my most recommended detox protocols is doing coffee enemas because of the excretion of bile that you get, the release of bile from your gallbladder. And then it's great to take binders as well if you're doing any type of detox protocol, including coffee enemas, because the binder will clean up the metals in the bile. And today, many people don't make enough bile, so they either don't get the right nutrients they need to make bile, they're not consuming enough PC or phosphatidylcholine, or they just don't, their bodies just aren't making enough for whatever reason. They're not consuming enough cholesterol, they're trying to reduce their cholesterol intake because they're listening to the American Medical Association to tell them, not to eat less meat and not eat butter and not eat all these, saturated fats that are dangerous for your heart, which could not be further from the truth. What ends up happening is if you eat a diet that's too low in saturated fats, that's too low in certain kinds of fats, you won't be able to make enough bile. And so many people today don't make enough bile. That's why I give people bile salts or ox bile or phosphatidylcholine to give them these basic building blocks to make more bile. So the coffee enemas only facilitate that process and help in that process. As soon as you stop doing the coffee enemas, it might take your body a little while to adapt and to start making more bile on its own. But it's certainly not something that you're probably going to feel or really have a negative impact as a result of that. So that's a very common question that people are concerned about getting dependent on coffee enemas for various reasons. You don't have to worry about that. As soon as you stop doing them, your body adjusts very, very quickly. So Susan, hi Wendy, I'm trying to detox from lead, cadmium, barium, and mercury. I also have mold toxicity. And you've mentioned before that you've also had mold exposure, which I did. And so which binders would you recommend I take daily to maximize detoxification of both metals and mold? I'm currently using Pectacell C and Chris Shade's Ultra Binder, and sometimes also Takasumi Supreme. I'm also curious about Dr. Pompa's Cyto Detox. Yeah, so that's a lot of questions there. So for mold mycotoxins, I really like this Zeobind by BioPure. This is Dr. Dietrich Klinghart's product line. So this is really, really good for mold exposure because the mold spores stay in your body and they start releasing all different kinds of toxins, like they're called mycotoxins. And zeolites, this powdered zeolite, is great at absorbing those toxins that the mold spores are producing. You can also do infrared saunas, and but typically you want to go to a doctor that specializes in mold toxicity. and to find out exactly what type of mold spores that you have, so that you can take supplements or medications to rid your body of the mold. And also, you have to get out of the moldy environment that caused the issue in the first place. That's what I had to do. I had to sell my house because of the mold issues in my home. And I feel a lot better as a result after I moved. But yeah, so I've been taking the Zeobind for that reason. And Pectisol C is great. Chris Shade's Ultra Binder, I use both of those products. Those are great binders. Those aren't necessarily going to get mold mycotoxins, but you can add the Zeobind to it as well to help with that process. And so Susan, so can the Pectisol C be combined with other binders? Yes, it can. Yeah, and it's great to rotate binders. So if you're taking the Pectisol C, maybe you've been taking that for a while, you can definitely start a different binder. I love Chris Shade's Ultra Bind. There's also, there's a great product called Parasite Detox from Kiwi's Corner. I don't have it here on my desk right now, but that's a great product to take as well. That's got activated charcoal. It's got green maglemite clay, and it also has a little bit of, has another type of binder. It has a modified citrus pectin in it as well. It's fantastic. So lots of different types of binders out there. And so you can definitely take other binders in addition to the Pectisol C, like in the same day, is totally fine. The Pectisol C stays in your blood for about 12 hours. And so you don't really need anything for 12 hours after taking the Pectisol C. So you can take something else in the evening, for instance. But I'm not a huge fan of taking activated charcoal every single day because it can detox minerals. It can absorb minerals. So it can be a little bit too taxing on your body to do that. So Elda, so for people with no gallbladder, are coffee enemas suggested? Yes. So coffee enemas are great to help the body release bile, but the liver makes bile, so it's just going to facilitate that process. And it's also to help detox the liver. The coffee enemas are the one of the best ways to mechanically detox the liver and help wring out the liver. And so I recommend coffee enemas to everyone, but it's one of those things where you have to try it and see if it works for you. It may not work for you for whatever reason. So just try it and see if it's something that works for you. And you want to feel good after you do them. If you don't feel well after you do them, maybe you need to use less coffee or just do something, troubleshoot it and try to figure out what works for you. So Laurie, so what do you think about the liquid nanozeolites TRS spray binder? I honestly am not familiar with that product. I'll have to look that up. I'm just not familiar with it at all. So Nick, so I use Pectisol C, but find it makes me constipated. How can I improve the flow? So yes, different people react to Pectisol C differently. It is a fiber. So for some people, it will stop them up. I mean, a great thing, again, to do is coffee enemas to help with that. You can also take some magnesium oxide. So you can take something, it's called oxy, I forget, the name's escaping right now. It's oxy powder from Global Healing Center. That's a great thing to take. It's a magnesium 7, but you can get any product on the market, any kind of magnesium 7, O7 on the market, and that can help with the flow, but go easy on it because it's pretty strong. So Kathy, I'm postmenopause and have metal toxicity. My lead levels a year ago were almost off the chart, 30 points for whatever the measure is. So I've been working hard for the last year to naturally detox, and my last urine challenge test showed that I'm now down to 17 points. That's great, but still 3 times what is considered safe. I also have Lyme disease, and both of these conditions have similar symptoms. So I sort of feel as though I need to focus on metal detox first, that's correct. Because many times when you have metal toxicity, the metals interfere in your immune system functioning, and that's why your immune system can't conquer the Lyme disease. So of all the medical practitioners that I've spoken to, it's really important to bring the metal levels down and then address the Lyme, because the metals interfere in your immune system functioning and your energy levels that you need to heal. Because with Lyme disease, you don't necessarily eradicate it, you just keep it in check. So you need to have a healthy immune system to keep the Lyme disease in check and prevent symptoms from flaring. And my mitochondrial function is severely impaired and I have no energy or stamina. do Lyme and metal toxicity exacerbate each other? So that's great that your lead levels went from 30 to 17, but it's one of those things, keep doing the detox. You know, some people have just very high lead levels and you have to keep it up. So you said here you've been working on it for the last year. You probably have a couple more years to go when lead toxicity is concerned. But I'll go over some great supplements you can also take to facilitate lead toxicity. And so let's go over some of those metals, or some of those supplements that help to detox lead. So there's a lot of supplements, natural supplements that detox lead. One of them is cilantro. So cilantro tincture or cilantro extract is fantastic at detoxing lead. I also love this perfect pressed coriander seed oil. It's the seed of the cilantro plant, and it's this oil is a fat, so it's very, very good at getting into your brain and your nervous system and to remove lead from your body. DMSA, also fantastic. So the most effective compounds to detox lead are DMSA and EDTA, which are amino acids which grab onto these metals and remove them from your body. And so EDTA suppositories are fantastic, but many doctors, when you're working with them, they're automatically going to do the DMSA IV chelation, which I don't recommend unless the people really know what they're doing, but sometimes it's necessary, it's life-saving. They have to do the IV chelation to bring the lead levels down to a certain level, especially after an acute exposure. And so it is warranted sometimes. I know my colleague, Dr. Dietrich Klinghardt, Dr. Christine Schaffner, will use IV DMSA. They obviously know what they're doing. There's a lot of doctors out there that don't. They're only offering IV DMSA chelation, and that's not necessarily the place to start unless you have a really an acute exposure or extremely high lead levels where your health is at risk. So some of the other supplements you can take are intestinal metal detox, or IMD, by Quicksilver Scientific. It's fantastic because we get a lot of lead in our food, in the food that we eat, meat, vegetables, and even some supplements, green powder, because the lead is in the soils. So food is a big exposure today for lead. And intestinal metal detox is great because it's a certain type of silica that gets into your intestines, that absorbs any lead that you might consume in your diet and prevents hepatic or intestinal recirculation or absorption into your body. So it just goes out through the stool. So it prevents that absorption into your body. So it's fantastic in that way. Also for lead, a modified citrus pectin is fantastic. My new Citra Cleanse, modified citrus pectin, very good at absorbing lead. And also sodium lipoic acid. It's not your typical lipoic acid. It's more like a fatty lipoic acid that gets into your brain, gets into your nervous tissue, and grabs onto lead and removes it. It's really one of the most effective ways to remove lead from your brain and your nervous system, and that's why I give it to all my clients that are doing my Myers detox protocol. And curcumin, which is the active ingredient in turmeric, is fantastic. And just using turmeric in food and in cooking, juicing turmeric root, and taking supplements with high levels of curcumin is fantastic. Garlic is really good at detoxing lead. NAC, or N-acetylcysteine, is fantastic also. That's a precursor to glutathione. And vitamin C, so liposomal vitamin C, can be very effective at detoxing lead, as well as taurine. So taurine is an amino acid that's a sulfur-containing amino acid that is excellent at grabbing onto lead, and that's found in meat. So meat actually helps you to detox. That's something that may be counterintuitive to a lot of people, but animal protein, like red meats, have taurine in them, they have zinc, they have lots of minerals in them, they have B vitamins, and all these things your liver and your body need to detox. Those are the raw materials your body needs. Vitamin E is also shown in research to detox lead as well. I think you get plenty of that in your diet, so I don't typically recommend people to supplement that, but it is shown in research to help to detox lead. And so aldose. So does zeolite bind to nutrients also? So zeolites can bind to certain minerals. I don't know off the top of my head which ones, but any kind of binder you take to some degree will bind onto some minerals. But that's why it's really important when you're taking any type of binders, you want to take a multi-mineral supplement as well. Really, really important. I love Oceans Alive. I take this every single day. It's a macro mineral and trace mineral supplement. It's fantastic. You also want to take zinc and magnesium and selenium every day as well to replace any mineral loss you might have from taking binders or doing infrared sauna or other detox protocols that you're doing. So Raymond, I took a urine challenge test from doctor's data. My lead levels were very high. I do frequent infrared sauna sessions. Should I be taking binders every day that I do the sauna? I have activated charcoal pills from Bulletproof. So yes, anytime you're doing any kind of detox protocol, you want to be taking binders. So that includes the infrared sauna, because you start mobilizing all these toxins from tissue storage sites and you start, releasing a lot of toxins in the bile. You want to be taking a binder to grab onto anything that may not be excreting through your skin that you then shower off following doing an infrared sauna. So very, very important to do binders. Like my CitraCleanse product, a modified citrus pectin, after doing or before doing the sauna or the day of. I don't recommend taking activated charcoal on a daily basis. You can take it once or twice a week and that's fine, but I don't recommend doing it every single day. So Beverly, so what is your opinion on high dose vitamin C for lead toxicity? How much vitamin C would you recommend? So for lead toxicity, taking high doses of vitamin C can throw your body chemistry off. I like high dose vitamin C for infections, for cancer, for a number of things, but I'm not a huge fan of the high dose vitamin C for detox per se, because I think you have to take way too much of it to have the desired detox effect. There's a lot better products out there if you're trying to detox lead. There's much more effective products out there. Does it detox you? Yes, but I wouldn't do a super high dose of vitamin C. I wouldn't do like IV vitamin C therapy to detox lead, but I would in the case of an infection. So Celeste, what are the symptoms of lead toxicity? So let's go over some of those. So fatigue is number one. Chronic fatigue is the most notable symptom. Loss of memory, loss of vision, cognitive and behavioral problems, brain damage, even mental retardation. A lot of children, if they're exposed before 5 years old, can suffer significant developmental delays as a result of that. Antisocial behavior, violence, other types of behavioral issues, and delays in growth and puberty development as well. And so some other like health conditions that can be caused by lead or symptoms of lead toxicity are abdominal pain. A lot of people that have abdominal pain and they can't figure out the source, it can be from lead toxicity. People can also have hormonal issues, adrenal insufficiency. They can have aggression, allergies, dementia, anemia, anorexia, anxiety, arthritis, ADD, autism can be a result of early lead exposure in utero. Behavioral disorders, blindness, cancers, cardiovascular disease, cataracts. A lot of people don't realize that lead causes cataracts, or it's one of the contributing factors. So that's why as people get older and lead starts coming out of their bones, they develop cataracts as a result of that. There can also be concentration issues, constipation, depression is a big one, diabetes, gout can be a result of lead toxicity, headaches, high blood pressure, hypertension, same thing, hyperactivity, impotency and infertility. They can also have joint pain, kidney dysfunction, lowered IQ, repeat miscarriages, nausea, paralysis, Parkinson's, peripheral neuropathies, numbness and tingling. People can also have seizures. They can suffer from vertigo as well, and even weight loss. So a pretty large list of symptoms that can very easily be attributed to other health conditions. And so that's why if you're suffering any of these types of symptoms and you go to your medical doctor, they're not going to be looking at this underlying root cause of your health condition. Some of these are kind of subclinical that can be attributed to anything really. And so your medical doctor is not going to be looking at this as a root cause so that you can ultimately, completely, permanently get rid of these symptoms. So that's why detoxification is very, very important. So Kathy, so is Pectin-C contraindicated for SIBO patients? So yes, so SIBO is small intestinal bowel overgrowth, where many times people have, good bacteria. They have an overgrowth of this good bacteria in their small intestine. And so the Pectin-C is a fiber that will feed that good bacteria and cause it to overgrow. So you want to get treatment for SIBO before you start taking Pectin-C, and then it's fine. It's totally okay to take. So you want to be taking other binders in the meantime until you resolve the SIBO. So Joyce, so what do you do for cobalt toxicity? So we'll have another lecture. I'm going to go through all the metals doing this Facebook Lives and go over each metal. Cobalt toxicity is actually fairly rare. The thing on a hair mineral analysis, when you're looking at cobalt, it's not necessarily a toxic form of cobalt. Cobalt can just be present in the soils, and there's some places in the world that cobalt is more prevalent than in the places in the world than in other soils and different places. So typically when I see high cobalt, I don't think of that as toxic. It's usually a non-toxic form of cobalt that your body can't use, that it's just excreting through the hair. So it's not something that I really worry about so much. So Elda, which one of these binders, if any, are safe for children? So I love my CitraCleanse. It's amazing modified citrus pectin, totally safe for children. So that's what I'd give a young child. That's what I give my daughter. And so Judy, so I took chlorella and an extract of cilantro when I was on DMSA. Is that okay for long term? Yes, so cilantro and chlorella are fantastic for lead toxicity and totally fine to take long term as well. So that's all the questions that we have for today. Guys, thank you so much for joining me for this week's Facebook Live. We have it every Tuesday at 5 p.m. Pacific, 8 p.m. Eastern. And you can also get the replay of this anytime. You can go on my Facebook page, facebook.com/Myers Detox, and watch the replay at any time. It's always there. And you can also see the video on YouTube, on youtube.com/Wendy Myers. We always put all the Facebook Live videos on YouTube as well for any of our fans that are not on Facebook or anti-Facebook. I know you guys are out there. So you guys will watch a replay on YouTube. Thank you so much for joining me. And you guys can, if you want to try my detox protocol, it's called the Myers Detox Protocol that I developed after working with thousands of clients. You can see that in my store, store.myersdetox.com. We have a number of practitioners that I personally handpicked and trained. They can hold your hand through your entire detox journey and teach you all about how to detox properly and do testing to find out what specific metals that you have that are the underlying root cause of your health issues. Because I found that many people are eating amazing. So many of my clients they're eating perfectly. They're taking amazing supplements. They're doing everything right. They're exercising, they're sleeping, and they still don't feel well. And when that's the case, they need to detox. That's a missing key in their health regime, is not adding detoxification to their health regime. And that was what it was for me as well. I found myself at 37 just exhausted, feeling terrible, and I was doing everything right. I was eating perfectly and doing the whole list of things I just said. I was taking impeccable care of myself. I had no stress. My full-time job was taking care of my health, and I still felt like crap. It was only when I discovered I was very mercury toxic and arsenic toxic and uranium toxic and began detoxing those metals that I began getting my health back. I restored my energy levels. I restored my thyroid function. I started sleeping better. and I just generally started feeling better. I started losing weight easier, and I was able to get my health back. And that's why I started MyersDetox.com, was really just to, you know, publish what I was researching, what I was learning, because I want to get the word out to everyone that this is that missing key that you need to meet your health goals. And this is why you're not feeling well. So I applaud all you guys for joining me every week and listening to this Facebook Live and educating yourself about heavy metal toxicity and how to detox it, because you're on the right path. It's incredibly important in our ever increasingly toxic world to have awareness around toxins, awareness of what we're putting in and on our bodies, and detoxing these metals from our body so we can have the health and the energy levels and the brain function that we deserve. So thank you so much for joining me and blessing me with your presence. I love educating you guys about this topic, and I will see you guys next Tuesday. Thanks so much for joining me.